Community Asthma Partnership with Wolfson Children's Hospital and the Players Center for Child Health, presented by CC Needs. Now let's discuss the severity of asthma. Asthma is one of the leading causes why children miss school and a leading cause of hospitalizations in Northeast Florida. In 2019, the number of physician offices where asthma is a primary diagnosis topped 9.8 million. Parents who do not fully trust in providers are then not properly educated on asthma control and attack prevention, and their children have a higher incidence of asthma attacks. In 2020, according to the CDC, 44% of children less than 18 years old who were diagnosed with asthma had an asthma attack. 60,000 people live with asthma in Northeast Florida and may not know they even have the disease. The program overview. This is the Community Asthma Partnership with Wolfson Children's Hospital, or CAPW. Easy Breathing provides education and resources to physician offices, schools, and community partners to increase education on asthma identification, treatment, and establish follow-up care. In addition, there are high-risk asthma protocols. Patients are enrolled if they have been seen in the ED 4 times in the last 12 months, or they've received 2 admissions in the last 12 months, or a PICU admission even once for asthma. Patients are then followed up 2 weeks after discharge and once a quarter. The goal is to keep patients out of the ED for asthma-related complaints. Currently, 124 families are enrolled in this program. Monitoring of program operations. CAPW is overseen by a medical director with Nemours Children's Hospital's Pulmonary Department. The program director is Megan Dank, and the education director is Carrie Smith. The results of this program. Easy Breathing was developed by Dr. Michelle M. Coultier in Connecticut in 1998. The pilot study was so successful and led to expansion of the program by 2007. When guidelines are used, they have shown to be effective. These are the results from Connecticut. 70,000 children were enrolled in Easy Breathing. More than 20,000 with physician-confirmed asthma were then identified. Adherence to national asthma guidelines for inhaled corticosteroid use was then at 93%. That increased the ICS threefold. It decreased oral steroid use threefold. 94% of children have written asthma treatment plan now. Decreased hospital stays for asthma was 31%. Decreased ER visits for asthma was 29%. And decreased urgent care visits for asthma was down 35%. It also reduced clinician and staff time by 50%. This is the time dedicated for asthma teaching and management. Easy Breathing program that is led by school nurses decreased asthma-related absences by 25%, as well as increased proper inhaler use among the participants. Additional results for the CAPW program here in Northeast Florida. Currently, 124 families are enrolled in the high-risk asthma community program. Admissions to the hospital due to asthma were significantly decreased in 2020. ED visits as well were decreased due to asthma in 2020. Families were also able to fill asthma prescriptions before running out, and this ensures that their children do not end up in the ER or in an urgent care for a refill of their prescription medication. The CAPW program is funded by an endowment. It's also supported by the Players Center for Child Health. In addition, it is a cooperative effort with local hospitals, the Duval County Health Department, pediatric and adult pulmonologists, and allergists. It increases access to asthma care and education regardless of anyone's ability to pay. Here's a diagram that shows the Players Center for Child Health. It includes community education, prevention, access, wellness, and advocacy. Sustainability and revising program interventions. During COVID, changes had to be made due to the new virtual environment that children now face with schools. Families were called once a month to follow up. This ensured patients were getting their medications and up to 3 months worth of medications. It ensured patients were wearing their masks and stressed the importance of mask wearing for these patients. A YouTube video was also created for teaching and reinforcing inhaler use and monitoring of signs and symptoms of an asthma attack. In addition to the COVID changes, in 2020, treatment guidelines for the control of asthma were updated. These guidelines are currently being integrated into the easy breathing training and education through CAPW. Some unintended effects of this program. Social determinants of health has given additional insight into missing parts of the program. It showed that there is a need for additional support when child protective services are involved. A social worker was added to the staff to help increase family contact and compliance. This also helped during the transition into the COVID-19 virtual environment. CAPW is a great resource for the community. It provides resources such as asthma education in schools, child care centers, and the community, in home asthma education for children and families with difficult to control asthma, as well as online and on site resources for family care providers and pediatricians by an easy breathing specialist. Tools for success. It is an easy breathing survey, and it's a provider assessment. It determines the severity of asthma for children who are newly diagnosed, determines the adequacy of control for previously diagnosed asthmatics, and it gives you the asthma control test, the ACT, and it can be used for children 4 years and older to assess the control. Based on that, you have a treatment selection guide. It's based on asthma severity. You come up with an asthma treatment plan. You have your daily plan, your sick plan, and an emergency plan. This also allows for asthma follow up or an additional asthma control test. CAPW adheres to the National Asthma Education and Prevention Program guidelines. In addition, Wolfson Children's Hospital is one of 7 asthma friendly hospitals in Florida. Thank you for watching. Here are my references.